Hi everyone, I'm Chloe with In Lung Cancer Now at the IU Simon Comprehensive Cancer Center. Welcome to Clinical Chats, where we take a closer look at real conversations between patients, physicians, and the communication choices that shape them. Because clinical trials aren't a last chance. In fact, they're one of the ways progress in cancer care happens. In this episode, Alex has been recently diagnosed with cancer and is eager to move forward with a treatment plan. A devoted husband and father, he approaches his diagnosis with urgency and determination, driven by a strong desire to protect his family and bring clarity to an uncertain situation. In their discussion, Dr. Muthuswamy and Alex explore Alex's concerns about the time and screening steps involved in a potential clinical trial, while working together to review his options and find a path forward that aligns with his priorities.
So next I want to talk about what we typically do to treat this, okay? Typically for stage 3 lung cancer, the treatment is a combination of chemotherapy, which is those IV medications we talked about, and radiation, which is essentially zapping the tumor to get rid of it, okay? The thing is, even with those two together, a lot of times, and most times, the cancer comes back. So we're still trying to figure out, how do we treat the cancer and prevent it from coming back, okay? And we're still working on that, right? Right now, we typically use something called immunotherapy on the back end. Are you familiar what immunotherapy is?
Kind of. My understanding is you take part of my body, do some wizardry with it, and then put it back in?
Yeah. So it's similar to that. So the chemotherapy and radiation would be about a month, 5 weeks, so a little bit more than a month, okay? And then for a year, we do recommend immunotherapy. It's similar to chemotherapy, but more specifically to attacking the cancer, okay? It's also an IV medication, and what it would do is essentially boost your own immune system to kill the cancer, okay? So that's what we're doing now. But I do also want to talk about a clinical trial that I thought would be a good option for you. Clinical trial, have you heard those words before? Do you know what that means?
I've always thought of it as the Hail Mary of goners.
Reframe trials as an option, not a last resort. Clinical trials are often perceived as the last resort because, in the past, they were primarily offered to patients that had already exhausted standard treatment options. Therefore, it's important for physicians to clarify this with patients so they can understand that trials can be an option, not a last chance. Helping patients understand when and why a trial might be considered can reduce fear and allow them to view it as one possible path among several treatment options.
Yeah. I know a lot of times we have that misconception about clinical trials, but it is not the case for most clinical trials. It's being able to deliver some state-of-the-art treatments for patients that might be better than the standard treatments that we have. So we talked about last time how we do full genetic testing on the tumor, okay? And yours had a specific mutation in it. Remember we talked?
Yes, indeed.
Yeah. And so let's say, you had stage 4 lung cancer, okay? That's when it's spread in multiple places, which you don't have. But we would be giving a medication, a pill by mouth, okay, to treat the specific cancer you have. But now we're wondering, okay, if we use that pill earlier on for curable lung cancer, will it help it more from it coming back?
So, side question. Yeah. So with this clinical trial, does this mean is this something where I would go through the standard treatment with this additional drug concurrently is the idea?
So talking a little bit more about the specifics, okay? So just to reiterate, the additional drug we would use is something that we're already using in patients. So it's not a new medication. You're not the first group of patients getting this medication. But you're right. So this is a trial to see if the addition of this medication would help patients with your specific lung cancer, okay? Not everyone, though, in the study or the trial will be getting that extra medication. And the reason for that is we want to compare if what we're doing already and just adding the extra drug won't make a difference. okay? Because we don't want to add an extra drug if it's not improving outcomes for you and just adding side effects and just another medication for you to take.
Thanks for watching Clinical Chats. Conversations like these help ensure that patients understand all of their options, including clinical trials, so they can make decisions that truly fit their lives. These conversations may feel challenging or uncomfortable, but are nonetheless important to have. After all, progress in cancer care doesn't just happen in the lab. It often starts with a good conversation. Today, Alex helped us explore what these conversations can look like. I'll leave you with him to share a little more about his experience.
So my name is Alex Washkirk, and I'm one of the individuals who works a lot with the Cancer Center in a capacity of making video. So if you ever go to any of their events, you'll probably see me walking around with a camera, really focused, trying not to be seen, which is hard when you're as tall as me. And I'll oftentimes make the recap videos for various events, do a lot of patient testimonial. My story kind of comes from a different place. Of course, I'm a human who lives in the Midwest, so my family has been touched by cancer numerous times over my whole lifetime. My first family member that I knew was my uncle 15 years ago, who was diagnosed with lung cancer, and he eventually did pass from that. But thanks to cutting edge research and a lot of things that we're talking about today, he was given more years, more Christmases, more Easters, more birthdays, more anniversaries. So everybody has a story to tell, and I love telling stories. That's one of the reasons I love working with the Cancer Center, is there's not a more pure story than that of a patient, a caregiver, an advocate, and the physicians, nurses, and researchers that are all working together to end lung cancer.